Let's think about nurses for a second. They're pretty much the backbone of our healthcare systems, right? They're the ones we see the most, the ones with the most direct contact with patients, and for a lot of us, they're the people we trust the most when it comes to health advice. So, what happens when these incredibly trusted professionals start to hesitate about something like a vaccine? Okay, let's dive into this. So, here's how we're going to break it down. First, we'll get to the heart of the matter with the question of trust. Then, we'll look at a really useful framework for understanding hesitancy. And this is the really interesting part. We're going to compare the wildly different situations in the UK, Italy, and Finland. After that, we'll try to figure out why they're so different, and we'll finish up with a big question about public health. When a healthcare professional recommends something, that advice carries a ton of weight. It's one of the single biggest factors that influences whether people get vaccinated. So you can imagine, when the experts themselves start showing signs of hesitation, it sends ripples through the entire system. It makes a tough public health challenge even more complicated. And this isn't just some theoretical debate. As you can see from this policy brief, this is a massive focus for health organizations and governments all over the world. They're all trying to understand the patterns that shape vaccine uptake among the very people we count on to keep us healthy. This really brings us to the core question here. It's not a simple case of being pro-vaccine or anti-vaccine. The reasons are way more nuanced, they're complex, and as we're about to see, they're deeply tied to personal, professional, and even national identity. So, to make sense of all this complexity, researchers came up with a pretty clever framework. Instead of just lumping all nurses into one big group, they used a statistical approach to find these natural clusters, revealing these distinct profiles of attitudes toward vaccines. But before we get to those profiles, let's just make sure we're on the same page with our terms. We're using the World Health Organization's official definition of vaccine hesitancy here, and the key thing to notice is that it's not just about saying no. It also includes delaying getting a vaccine. So it's a spectrum of behavior and attitude, not just a simple yes or no. And this brings us to the three profiles that the study identified. First, you have profile A, let's call them the confident, with very low hesitancy. Then there's profile B, the cautious, who are a bit on the fence, maybe moderately hesitant. And finally, profile C, the hesitant, who show high levels of concern. Keep these three groups in your head because they are the key to unlocking this whole puzzle. Now, this is fascinating. Despite all the differences we're about to see, one single concern united nurses across all the profiles and in all three countries. The biggest driver of hesitancy was a worry about unknown, long-term effects. That fear of the unforeseen, that was the common thread that tied everyone together. All right, with that framework set up, let's get to the core of this whole thing, the head-to-head comparison of nurses in the UK, Italy, and Finland. And as you're about to see, the results are, well, they're pretty shocking. In this table just lays it all out. The differences are like night and day. In the UK, nurses were overwhelmingly in profile A, the confident group. In total contrast, Italian nurses were clustered heavily in profile C, the most hesitant. And then you've got Finland, which is a complete outlier, with its nurses spread almost evenly across all three groups. Wild, right? Let's break that down visually. So here's the United Kingdom. You can see that huge spike for profile A. The vast majority of nurses who took part fell into that low hesitancy, high confidence category. Profiles B and C are just tiny in comparison.
Now look at Italy. It's almost a perfect mirror image. The largest group by far is profile C, the highly hesitant. You've got a good number in the cautious profile B, but almost nobody falls into the highly confident profile A, a completely different national picture.
And finally, here's the puzzle of Finland. Look at how evenly distributed those bars are. Confident, cautious, and hesitant nurses are all there in roughly equal measure. This tells us there's a much more diverse range of attitudes within the Finnish nursing profession compared to the other two countries. So, seeing these dramatic differences just begs the question, why? How can one single profession have three such different stories in the UK, Italy, and Finland? Well, the research points to a few key factors. A major piece of the puzzle seems to be government policy. Both Italy and Finland went ahead and implemented mandatory vaccination policies for their healthcare workers. The UK, on the other hand, had a mandate planned but then canceled it before it ever rolled out. This difference in policy seems to be crucial. Researchers suggest that in Italy and Finland, the mandates, while they were intended to increase vaccination rates, may have actually fueled mistrust and a sense of violated autonomy, possibly pushing more nurses into those hesitant profiles. But it's not just about mandates. Younger, less experienced nurses were more likely to be hesitant, right across the board. Then there's cultural trust. Finns, for example, reported super high trust in their authorities, which might help explain their unique, evenly split profile. And get this, their digital bubbles were different. More hesitant nurses were getting their info from platforms like TikTok, while more confident nurses were spending their time on professional networks like LinkedIn. It suggests the information world they were living in played a really significant role. So what does all this data, these profiles, these charts, these country comparisons, actually tell us? What's the big picture here for public health? Well, the key takeaway is this. Vaccine hesitancy isn't a single uniform problem. The idea of a hesitant nurse looks completely different in London than it does in Rome or Helsinki. It's shaped by national policies, cultural trust, and individual life experiences. A one-size-fits-all message just isn't going to work. And that leaves us with a final, crucial question to think about. This research shows that even within one of the world's most trusted professions, attitudes are incredibly diverse and depend so much on context. So, if the people on the front lines of healthcare aren't a monolith, should our global health policies treat them as if they are? It's a question worth pondering.